going to quickly now talk about, give you some of the local and national data about LARC and GOPs, and also what's in the contract that you have from Public Health. So, very quickly, we have very low rates of under 18 conceptions. And so you can see basically the years on the left, the actual number of conceptions, the rate per 1,000 16 and 17-year-olds, the rate per 1,000 in London and the rate per 1,000 in England. So you can see we're considerably lower both in London and England, and we're one of the lower boroughs in terms of that. Oops, sorry. Some abortion data. So the total abortion rate in 15 to 44-year-old women, we are about the same as the England average, a bit lower than London at the moment, which is good. In terms of prescriptions for LARC, so first of all, this is total LARC prescribed for Tower Hamlets. These are all Tower Hamlets data. We have lower rates than London and lower rates than England. Most boroughs in London would have much lower rates than the rest of the country. GP LARC is a bit lower than London, much lower than England. And I just wanted to show you, so this data comes from Public Health England, and you can do all sorts of fancy presentations, but I just thought this quite nicely illustrates maybe the benefit of LARC. So you can see at the far left-hand side, if there's low rates of GP-prescribed LARC, there's higher rates of abortions, and that line shows that the more LARC there is, the lower rates of abortion. And Tower Hamlets is the little black diamond towards the left-hand side. So I think that's just to illustrate that access to good contraception, particularly LARC, is beneficial in terms of reducing the abortion rate. And then just our SRH prescribed LARC, so you can see that we're about the same as London and better than England in our specialist provision of contraception. This is the data of your activity. So I've done for each type of LARC a table, and it's for 3 consecutive years. So you can see for each network, and across the bottom is the total for the whole borough. And the numbers in brackets are those that are done by inter-practice referrals. So a few networks are doing inter-practice referrals, but obviously the numbers are quite low, even in the networks that they're being done. So you can see that IUCD insertions have gone down in the last year compared to the previous year. IUSs have stayed about the same, and implants have dropped a little bit as well. So the next one shows the totals. And compares it with the previous year. So the red line is the last financial year. And in 2016-17, there were nearly 960 LARC insertions in total, and that had dropped to about 880 last year. And there's sort of fluctuations, so some networks are doing a little bit more, some a little bit less. There are sometimes obvious reasons why that happens. So it might be that an individual practitioner has left or gone on maternity leave or sick leave, and they haven't been replaced. But anyways, there is a drop, whereas in previous years it had been going up, and it's sort of dropped. And then I just yesterday got the data for Q1. So I've just put the total for Q1 along the bottom. And that is less than 25% of what was done last year. So I think we just maybe need to think about how we can boost that activity, and hopefully this kind of presentation or this kind of PLT will help you think about that. Okay. Any quick questions about any of that? Okay. So just a quick reminder of what is in your enhanced service contract from Public Health. So one of the aims is to increase the uptake of effective methods of contraception to reduce unwanted pregnancies. And then there's a number of other issues which we won't go into any detail around STI screening. So you get payments for insertions and removals. And this schedule is the same as it was in the previous year. So you get £90 per intrauterine device insertion, as long as you do over 23. And then you get bonuses as you go up to 50, over 100, over 150, etc. And £23 per removal. And for implants, you get £50 per insertion as long as you do at least 12. So that's at network level, with bonuses again, and £33 per removal, which is in recognition that it is a more complicated process than removing a coil. And just to remind you to remember to enter the information onto the Women's Health template if you want to get the payments for it. The rest of these slides are just about the STI payments, which are unchanged from the previous year, and I'm not going to go into them because we haven't got enough time, but they'll be on the presentation when you get it. Okay. Just going to give you a quick overview of the support. So when the specialist services were recommissioned, also the support that we provide to non-specialists was recommissioned. And so I'm just going to give you a quick overview. So this is a bit of advertising of the training that we are doing. So we have been commissioned to provide leadership across the system in terms of sexual health and contraception provision for non-specialist providers. That's general practice, community pharmacy, midwives, school nurses, health visitors, a number of groups of people we were asked to support. And that will include training and also provision of PGDs in relation to sexual health. So this is a quick summary of the training offer that we are giving. So we are offering competency training for implant and IUD fitting, which is for GPs, nurses and midwives. We are running SRH Essentials courses for practice nurses, which is a day-long course which has been specifically designed by the Faculty of Sexual and Reproductive Health for nurses in practice. We also provide training for the different stages of the diploma for doctors and nurses, and we are running a course of 5 on Tuesday the 25th of September. So anyone who wants to do the diploma and is at the point where they can do the course of 5, so you need to have done the e-learning and the e-knowledge assessment, please get in touch with us. And then obviously we do protected learning times like today. We'll also be doing training around STIs, so we do more informal training coming to practices or network meetings, PLTs, and we've also done, we do annual training for healthcare assistants who often do a lot of the STI screening. We will run a stiff course next year. PGD training for pharmacists and other nurses in certain other settings such as drug dependency unit, etc. C-card training and training for non-clinical staff such as youth workers and social services staff. Other support that we provide, so this email address, the first one is one that I've advertised for many years, and I do get emails most weeks, which can be used for all sorts of random inquiries. When is the next training? How can we're having problems with getting swabs. If you're having problems referring a patient, you can send referrals there, although it's not the best way, but I will forward them. And then there is, as Janet has pointed out previously, there's a referral form for STI problems on EMIS already with that email address, and we are developing a contraception one which will probably have the same email address for referrals. We also have a fail-safe, so any patients who get diagnosed with an STI in Tower Hamlets General Practice, we get informed by the lab of those results, and we will contact your practice with the details to make sure that you have been able to contact the patient and treat them or refer them to us. And you'll be asked a number of questions just to respond. That's something we've been doing for a long time around chlamydia screening, but we will be now doing it for diagnosis for any STI that you're screening for, including HIV. Some of those patients we would expect you to manage, particularly patients with chlamydia. Others need to be referred into specialist services, so we can assist with that. That's it.